even though we sometimes have policies and legislations for food safety standards, there is not really any legislations for sustainability. And no measurements available really. How do we measure sustainable food products? And we identified this as one of our private priority action and research areas to actually develop some kind of checklist for this. And that was also something that we discussed when it comes to what is really good enough, what is really safe enough food, that we do need to have more research supporting the legislation behind food safety standards. And they also need to be updated and they need to be contextualized. We also concluded that we really need to have more research on how to use food waste better in a safe way, and also how to work with post-harvest processes to reduce food waste. We discussed a lot about risk-benefit assessments, and that we also need to include more dimensions into it, including sustainability, and thinking of all the different risks and benefits with foods. And this also needs to include many stakeholders. There are many different dimensions, and we need many different people involved. So while it wasn't really a disagreement here, we found that there were quite different contexts. And you may class food security very much different depending on where in the world you're from. And there was also different understandings on what to include in the concepts of food security, food safety, and what to include in sustainability. And so one of our next steps will be to kind of create a network between us and potentially develop a policy brief. And also some of us were suggesting to write future research proposals on this. So that's kind of the summary of our workshop. Thank you very much for all the participants. Thank you.
Thank you. So foodscapes for the future. Peter, workshop.
Okay, thank you. So we had a workshop next...
You can use it yourself, yeah, so you get...
So this is the title, and we were quite a few working on this topic. And just briefly outlining, we defined... No, this is not the right one. Oh. Okay, let me check. It was in a hurry. Yeah, no. So I suggest the following. I mail another PPT file and you go. Okay. Yes, because we want to.
And so, 1 second, and then I also ask if we have the workshop leader for global health perspective on the future of meat to come up eventually, but no hurry. So, Marmar, you can now present, and that will be tackling antimicrobial resistance for sustainable food systems. And I think it's probably, no, that's on, don't.
That is on.
Yeah, but I think if we...
No, that was the one.
Nej, var den rätt? Förlåt. No, we're getting to late afternoon here.
Sorry. Hi, thanks. First of all, I want to really extend a big thank you to the delegates that chose our workshop. It was an intensive afternoon, but I learned a lot, at least. And I also want to extend a big thank you to the whole team. I don't have time to go through all the names, but a big thank you. So for those who don't know, I think most people do, antimicrobial resistance, or AMR in short, is a big threat, not only to human health globally, but also for our livelihoods and food security and development. So thus we need to find ways to tackle this global problem. And in our workshop, we had a bipartial session. So first we jointly identify what are the challenges, and also kind of thinking of the challenges in different ways, cultural, socioeconomic, and geographical, of course. And then we moved on to find the solutions and actions to tackle and solve in the way possible these challenges. Yes, so for preventing disease, there's a couple of things we can do and should do. One is to strengthen laboratory capacity, epidemiology, and logistics, but we can also increase access to affordable diagnostics, guidelines, and training in different ways. And another solution put forward were these animal health certification systems. And to improve knowledge, we need to build trust, but also increase communication, not only between farmers and the food sector, but also towards the whole of the industry, but also to animal health professionals. And then lastly, to improve governance, we need to consolidate. There are, as was mentioned this morning, there are quite a lot of resources, but we need to consolidate these and the funds that are available. And then we need to kind of target what do we want to solve with these funds. And then another thing put forward, it's also very important to tackle corruption in these different settings. So our next steps is to consolidate all of these identified challenges and solutions. We will try our best to write this policy brief for the post-conference report. We will also try to find different platforms to incorporate these actions and solutions. And I think with the teams we had today, all of our participants, we have good connections to do this. Thanks.
Thank you. So, welcome again, Peter. Foodscapes for the future.
Yes, I realized I included some of the presentation parts. So you can put up the same slideshow, and then I'll just flip over workshop G. Yes. Just that. So excuse me for doing this. It'll come. Okay, here we are, almost. So this is what we actually went through, and Anna-Karin told us about the current situation. And here, so this is how we discuss it. So we have a problem. The problem, as defined, growing prevalence of overweight and obesity, not in the least among teenagers. So the focus was teenagers. And with the help of two of the inspirational speakers who had put together a movie where they were mapping a municipality from the situation, what do teenagers do during the school day? And that movie, which can be seen here, it's 2 minutes. It's really interesting, and that was a little bit of the basis for the workshop. The unhealthy foodscape was put at center stage. And then we had 2 sessions. First session in the workshop, what are causes or root causes of this unsustainable foodscape that was exemplified by the Sefli example. And then after the break, after lunch, we were discussing what could be actions towards these. We chose 5 causes, and here they come. So the first cause, lack of policies. Well, you can read it. Lack of policies to regulate the foodscape. We've heard it today and yesterday, and the action, we can show how municipalities, what kind of consumption patterns they have by collecting data. That was added to the task. Can we follow this in a data-driven manner? So that was one action. And the other cause being highlighted was the high demand of unsustainable foods driven by social norms. And here we point towards national legislation. We need the support of national government to regulate the marketing, not in the least the marketing of foods to children. Here something is needed. Thirdly, low knowledge on cost of malnutrition amongst stakeholders. And here we propose 2 actions. This is not new, but a really health economic analysis focusing on this particular aspect, on ill health, malnutrition. And then, and this was inspired by one of our speakers, Deepa, and she's working with Victoria Health, where you can see an excellent example of how a national funding agency can be created. So we need that here in Sweden as well. Fourthly, young people are not actively involved in shaping their foodscape. And this was not in the least coming from Säffle. Elin and Fredrik, who have been working with these teenagers, listen to them. Listen to how they want to change an unhealthy foodscape towards health. And then fifth, low profit on sustainable food, like fruits and so forth. Well, we also need here some regulatory measures we propose.
Thank you. So, and welcome to share about a global health perspective on the future of meat.
Okay, thank you. Is it this one? Is it?
Let's go.
Okay.
Mm.
So, me and my workshop are actually just back from the future. We visit 4 different futures, depending on and valuing meat differently. So these are illustrating the futures that we visited. And these are where the delegates choose to go to. So you can see that there are a lot of our delegates choosing to visiting plant-based meat-less future and less meat future. And that was the base for our discussion. And we talked about drivers, that it is important if you want to go towards one future, what are the drivers, but also what are the vulnerabilities. And that is certainly what we want to bring further on for discussion going forward, to take a stand from the vulnerabilities and the drivers that can actually take us in the direction where we want to go. We also asked our members of the working group workshop here too, what do you bring home after this? And we got tons of good inputs, but we want to just highlight a few. Sorry, this was the other one. Where did I change my mind about? And we wanted to make a difference in these people's lives. And as you can see, that at least one said no, I didn't change anything. So I guess we can come back and work on that. Or I didn't change my mind, but I improved my understanding, which is an outcome that we are so pleased with, because that is what we were aiming for. You really want to increase the understanding of these issues and the challenges that we are facing. And then the last part, what would be your take-home message? And there are different solutions for different settings, and that is what we've heard for these 2 days as well. And we need to act more on existing knowledge than less on polarized values. And that was very evident when you talk about meat and differences in meat consumption and how you want to go forward. So that's pretty much what we were discussing when visiting the future. So thank you.
Thank you. And I think Peter, come up again, because I think you, as the other workshops leader, are all worthy an applause and an extra applause, because they put together those summaries in the coffee break while we others had coffee. So, thank you. And now we will start our final plenary session, Food System for Health, the Way Forward. And we will begin with some closing remarks by Dr. Matshidiso Moeti, who is the WHO Regional Director for Africa. So please welcome Dr. Moeti.
Good afternoon to everyone. I just want to check that I'm actually audible. Yes, I am. So a very good afternoon to you all. And to the organizers, a big thanks for the opportunity to deliver the closing remarks on how to advance the world towards food systems that enhance health. I've just caught the summaries that were being presented from the different groups and feel indeed very encouraged and very inspired by the discussions that you held here, which I unfortunately couldn't be part of. So given the upward trajectory of non-communicable diseases, particularly in Africa, where forecasts are that NCD-related deaths will overtake the combined mortality from communicable, maternal, neonatal, and nutritional diseases by 2030. This discussion could not be more timely. The promotion of diets that improve health but are also environmentally sustainable is emerging as a key global priority. This reflects a growing awareness of the extent to which global food systems are driving ecosystem imbalances, climate change, malnutrition, and of course, chronic diseases. Yet, and I think you've discovered it in your discussions, implementation is not very simple. On the one hand, is the acceptance that a holistic approach is imperative to successfully conserving human, animal, and planetary health, protected from unsafe food products through vigilance and the application of, On the other hand, are the often competing interests of the stakeholders and sectors charged with identifying and instituting the requisite solutions. However, there are collaborative mechanisms with potential to drive successful action. An example is the One Health approach, which aims to sustainably balance and optimize the health of people, animals, ecosystems, and the wider environment. Together with WHO, the One Health quadripartite brings together the Food and Agriculture Organization, the World Organization for Animal Health, and the UN Environment Programme. I'm certain this has already been mentioned to you during the course of this meeting. It mobilizes multiple sectors, disciplines, and communities to work together to tackle threats to health and ecosystems while fostering well-being. It also addresses pivotal issues such as the collective need for clean water, energy, and air, safe and nutritious food, along with climate change and sustainable development. We need all of that. We've heard a lot here today, I think, about the concept of food for health and how to put it into action for the good of people and communities. And I'm pleased to share that since the UN Food Systems Summit in September last year, 33 countries in the WHO African region, which is mainly sub-Saharan Africa and Algeria, have developed food systems transformation pathways. These are focused on, among other things, changes to public and private investments and policies to regulate food environments. Inter-country dialogues are continuing under the auspices of the African Union on the continent in partnership with UN agencies and non-governmental organizations working in the area of food and nutrition security. And within these dialogues, WHO is working with the AU Commission and the FAO to integrate food safety in the implementation of the Africa Continental Free Trade Agreement. This will ensure that human health is protected from unsafe food products through vigilance and the application of the Codex Alimentarius standards in cross-border trade on the continent. Another outcome of the UN Food Systems Summit is the formation of global coalitions to work together to transform food systems in a globalized economy. These coalitions enable collective negotiating power while facilitating knowledge sharing. The coalition that is directly relevant to today's gathering is the Coalition of Action on Healthy Diets from Sustainable Food Systems for Children and All. Its aim is to act as a mechanism for coordinated action on healthy diets from sustainable food systems, facilitating the sharing of experience, championing policy actions, and gathering support, information, and even inspiration. Policy and regulation is a key area for action, and WHO recommends 6 related actions. First, taxation of unhealthy foods and the subsidies for healthier options, I saw that in one of the slides a moment ago. Regulated marketing of foods and non-alcoholic beverages, especially to children. labeling of packaged foods, including information on the content of certain ingredients, public food procurement for healthy diets, food reformulation to eliminate industrial trans fats and reduce salt and added sugars, and food fortification with vitamins and minerals. It's relatively easy to develop policies. It is their implementation that's the challenge, and I'm certain that's what you've touched on in the last couple of days. Among the main reasons are weak governance systems in less developed countries, and of course, opposition from private companies that are profiting from the uncontrolled marketing of unhealthy products. And unfortunately, they sometimes have support from some governments. For example, we've seen in Kenya that the attempts to implement regulation of breast milk subsidies were challenged by two high-income countries, which I will not name here, and the World Trade Organization, which was set to discourage the Kenyan government. These companies also approached parliamentarians in Kenya to influence their policy position in relation to what their government is doing. However, we're happy to report that both attempts failed, fortunately, and I think what we need to understand and learn among themselves is what happened, why. But these are the sort of actions we need to be anticipating and which need to be addressed, hopefully by our collective action. As such, it's critical for global coalitions, therefore, to mount effective international advocacy for accountability for borders. Accountability without borders, sorry, that's a phrase that my colleagues told me about today, which I found very compelling, meaning we need to share the approach to accountability between different stakeholders if we're to achieve these objectives. And part of that is to encourage, compel food manufacturers to uphold the same food standards at home as they do abroad when they market their products. Although industry self-regulation has not succeeded in reducing accessibility to unhealthy foods, we observe that there is the emergence of some positive engagement, and hopefully this will get us to the results that we need. Examples include the upholding of food safety standards, food fortification, and the ongoing dialogue between international advocacy groups like Resolve to Save Lives, which is an NGO and a group that's working very hard on trans fats and the sugar content and salt content in foods in collaboration with WHO, and industry actors towards eliminating industrial trans fats from processed foods. Improving regulatory capacity is also an urgent, important action area for less developed countries. Kenya, Uganda, and Tanzania have been supported through a multi-partner global regulatory and fiscal capacity building program, RECAP, to strengthen their national capacities for the development and implementation of regulatory and fiscal measures. These countries are advancing in updating food labeling standards, and negotiations are underway to expand to other countries of the East African community. So again, working collectively within sub-regional intergovernmental organizations can also provide mutual support. Standards to guarantee safety and nutritional quality of food from farm to fork need to be developed, disseminated, and enforced. And this demands urgent capacity building alongside advocacy for developing countries to mobilize domestic and international funding. And let's not forget the importance of communities buying in. Experience has shown that when an idea works to address a recognized need in a community, that is adequate incentive for people to make the necessary effort to sustain the change. There's the example of the Alternative Livelihoods Initiative, where WHO, in partnership with FAO and the World Food Programme, support Kenyan tobacco farmers to switch to producing alternative crops. The Tobacco-Free Farm Project enables farmers to collectively source farm-related and other services, helps them to identify markets for produce and negotiate prices for various value chains while training them in good agronomy practices. After being supported with nearly 4 tons of seeds and other requirements, more than 1,000 farmers in Kenya are now growing red beans on hundreds of acres of farmland previously dedicated to tobacco. The beans are high in iron and so have greater nutritional value, making them a preferred choice for purchase and distribution by the World Food Programme. And the associated benefits have been immense in these communities. They include improved school attendance among the children of these families who previously worked on the tobacco farms, improved household food security, reduced exposure in work-related chemicals, and tobacco smoke, and of course environmental conservation, and ultimately reduced poverty. Now the initiative is to expand to three other Kenyan counties and to 2 other countries, Uganda and Zambia. And as the previous director of non-communicable diseases in WHO some years ago, I can attest how much effort and how many years of relentless work this took. But it is an example that shows that working together, it is possible to reach such changes and such results. I'm sure that this is an example which is not quite exactly what we're talking about in this meeting, but it shows, I think it can be applied across the issues that concern us here, which are animal health, food, healthy food, livelihoods for people, and then international regulations and national action by both governments in upper income countries where these industries have their homes and governments in countries that may be persuaded to consume these foods. We believe there is a lot of hope for these types of approaches. As WHO in Africa, we remain fully committed to the health and welfare of people across the continent and to forging partnerships with individuals and with organizations eager to support the work to achieving the goal of a healthier Africa and world. And I'm certain that we'll draw from your discussions today the inspiration and good ideas as WHO to play our role within the broader partnership to achieve that as well as a healthy planet. Thank you very much for the attention you've accorded me this afternoon.
Thank you. Thank you very much, Dr. Moeti. Yeah. Please step down for a minute if you like, or if you can wait here with... come and wait here with me.
Okay.
But we reorganized the stage a little bit.
All right.
And I just actually thought, while we get ordered here, to highlight what Corinna Hawkes said this morning on leadership. And the first thing the food system said about what happened that created the big change. And the food system said, there were women leaders, a lot of them.
Oh,
Than
okay.
leadership in general. So, but I thought that was a nice
Thank
reflection back also to you. So we will now have a concluding discussion, and I welcome up on stage Dr. Anders Nordström, who's Ambassador for Global Health and from the Swedish Ministry of Foreign Affairs, Dr. Stefan Swartling Peterson, who is Professor of Global Transformations for Health at Karolinska Institutet and visiting professor at Makerere University, Uganda, and Uppsala University, and also the chair of the advisory committee for the Uppsala Health Summit. And Mr. Loay Radwan, young leader for Sustainable Development Goals at the United Nations. So, and when you get a chair, please be seated. Great, nice to have you here. So, first, I'd like to turn to you, Loay. Considering at these times, it feels like youth is sort of really at the forefront of these days. So you've been here throughout the summit, and I'd like to ask you to give the sort of a youth perspective around the issues that we discussed, and where are your thoughts today, given the topics and your background?
Hello. Okay, it's working. Thank you for this great question. It's an honor to be here. Thank you for inviting me. So when it comes to youth perspective on the issues on the health and food systems, I think we need a total transformation of the way we produce, process, distribute, consume, and waste our food. World poverty is increasing, world hunger is increasing, we're having high population growth, and on top of that we have climate change that's disrupting the whole water, energy, and food network, causing more and more burdens to the farmers, And that's, as a result of that, we have high urbanization waves all over the world. Young people now don't want to work on agriculture. Agriculture, which is the cornerstone of human existence, is now looked down upon by young people because it's always related with being poor, living in poor conditions, dealing with soil erosion, biodiversity loss, water scarcity, disrupted rainfall patterns, and so on. We now have the largest world population in history. 85% of them are living in developing countries where agriculture is mostly the main source of income. And if these young people don't want to work in agriculture, and with the FAO expecting that we need to increase our food production by 60% by 2050, then we're facing an unprecedented challenge when it comes to food security. So it's clear that we need to change the way our system is working, and not only our food systems, our water, energy, food systems, all of that need to change. And young people who are the future have a huge role to play in that, and that's why governments and everyone need to empower them.
Thank you. That's a really important point that has not, as far as I've heard at least, been up here, sort of the level of interest or the lack of interest in agricultural system. And I think it's similar here in Sweden, as I've heard. So Stefan, being the chair of the advisory board of the summit and been here and been also in the preparations of everything, can you share with us any patterns or underlying structures that you see emerging in your perception from spending the days here, immersed in the conversations?
Thank you. I have a few mental notes and possible takeaways. And one of them, I think, from yesterday is that 3 billion people in the world cannot afford a healthy diet. And that's quite fundamental. And then I add that to my previous recollection of our UNICEF report the other year, showing that 2 out of 3 children in the world don't get the food they need. Too little, too much, or the wrong kind of food. But then I think I'm also reminding myself that the cheapest food can actually make you fat. And in many ways, in here, as well as in Africa, the cheap calories somehow are not the healthy ones. So it's not necessarily underweight only. And in fact, I think we heard Namokolo discuss yesterday the double burden of malnutrition. The fact that you have stunted children who are too short for their age, but at the same time you have rising overweight and obesity rates in adolescents and adults. And that's of course bad on the nutrition side, but it also reinforces the double disease burden. Because Tsidi here, Dr. Moeti, has to contend with continued infectious disease, maternal mortality, and then tackle the non-communicable disease crisis. And I think the dynamics there are actually very big, because in the research I did with I have my Makerere tie on here today, we actually showed that in rural areas in Uganda, the diabetes prevalence in adults is double that of Sweden. And if you listen to Meena, who has spoken a lot about Kerala in India, it's 4 times Sweden. And this is now on an upward trajectory. And that dynamic is so forceful that it can actually overwhelm healthcare systems, if nothing else. So coming back to, I think, what reflections on our summit here and how we need to go is that as we discuss this, I think we need to although we are in Sweden, we must remember that it's not just overnutrition, it's undernutrition and all forms of malnutrition. And Africa's challenge in many ways is much more complicated than the one we have here in Sweden. Particularly now that your urban population, which is landless, is for the first time rising so quickly. It used to be that everyone in Africa had land. That's no longer the case, right? And then you add the climate crisis and decreasing agricultural yield, displacement of people on top of that. So you have a busy job, Moeti. And for us, I think we need to globally reflect on this. But the hopeful note I see is that there's still room to prevent some of the mess that we are in, because you can still stifle some of the nutrition transition. People may have aspirations for hamburgers and instant noodles and other things, but maybe you still have time to stop that. My final point is the one around trade. I really like this accountability without borders. Thank you, Sidi, for that. Because I think we cannot have double standards in what you can sell in the European Union and what you can export. And I'm very much looking forward to the European Union's global health policy strategy, which will come next month. And I'm hoping that it will not just deal with a bit of aid, but that it will actually go straight into where the European Union is strong, regulating trade for the reasons that Dr. Moeti laid out. And I think that's something for you, Anders, and the Swedish presidency of the European Union to take up.
Thank you, Stefan. Yeah, turning to Anders, and for those who don't know, Anders is a medicinal doctor and a long-time diplomat in various positions. So Anders, what trends are you seeing in the field of food system and health, sort of from the outside, because you haven't been in here for 2 days? So.
No, thank you very much. First, to respond to Stefan, just to say, I can promise you that there will be no recommendations about hamburgers in that strategy. But there will be quite a few other messages that will be very much, I think, in line with your discussions here. And that is sort of what I'm hearing, seeing, picking up, also relating to this, that we see some big mega trends in societies that you've been speaking about, we've been speaking about here. Food transition, but also energy transition, urbanization, demographic changes, all of those in some way man-made. And unfortunately, all of those then moving us in a direction of worse health for animals, for people, and for the planet. So I think this kind of discussions is important in order to reverse this trend, because the trends are taking us in the wrong direction now. So to collectively see how we can reverse those trends. A figure that I got with me from a piece in The Lancet that was published last year, they looked at 8 of the big countries in the world, 50% of the world's population, 70% of where greenhouse gases are, the emissions are coming from. They saw that if we would implement the Paris Agreement, from a public health perspective, we would save 6 million lives per year. And if you remember how many we have lost now from COVID, and if you think about how we have mobilized the world now for COVID, 6 million 1 year if we would implement the Paris Agreement. 6 million we have now, basically the whole world has just done one thing. So could we do that other thing instead? Also, what I'm picking up in terms of way forward and trends, sort of where I think we need to move, 3 things. The first one is then to move from sectors to systems. And that is a bit difficult for us because we are organized. Science universities are organized according to disciplines. Veterinary medicine, human medicines, ecologic, etc., etc. So it's difficult to take a systems perspective. Same thing for governments in terms of ministries, and the same thing for the international organizations. But the trend is saying we need to move beyond the sectors and work more in a systems approach. The second one is to talk about, and I'm hearing more about this, the co-benefits, but also the trade-offs. Can we maximize the co-benefits, but then we need also to talk about what are the positive and negative trade-offs here. And the only way of doing that is to be clear about what we would like to achieve, what is really the goal. And we have very clear goals for our climate work. We're less clear about the goals for our health work. What is a single indicator here that corresponds to the 2 degrees on health? And also to be clear about what our ultimate impact that we would like to achieve and what our means to get there. A healthy diet, for me, that's a means in order to achieve a final outcome. But we need to be clear about this logic and talk about the co-benefits and trade-off to become as effective as possible. And the final one, which is also very much been now debated during the COVID outbreak, is about the links or lack of link in between evidence and politics. And I think we need to have a better understanding of that there is a logic to politics, even if we as technical people do not believe that, but there is a political logic and there is political science. And I think to find this more effective way of working between evidence and also activism and politics is another trend that I see that we are beginning to learn. And I think that's important for the future. Thank you.
Thank you very much. And I'm just heads up that we will invite you also to pose questions. But first, I would like to turn to you again, Sidi. So the issue of power and the issue of power and leadership has come up here during the summit as important levers for change. So could you reflect from WHO Africa perspective to where should more power be transferred? And from whom would you ask for stronger leadership to reach the goal of health for both people and planet?
Okay. If I can just pick up on a comment from Hans, Anders, I don't think we're not clear about health goals. Really? I think we are clear about the health goals, but I guess the conversation here is how we progress in achieving good health and well-being all over the world with a strong emphasis on equity, and not just equity within countries and within societies, but equity across the world in the face of some of the issues that are being discussed here. So I think we are clear about where it is that we'd like to go. Otherwise, I deserve to be sacked, to lose my job, at least from Africa. I think to answer your question, so where does the power lie? Where should it be? I mean, I think that at the moment, what we see is an imbalance of power between the industries that drive some of the unhealthy foods and the communities that consume them. There needs to be a power balance between governments, the industry, and people as well, in my view. So how do we mobilize and enable people's power? I think some of the discussions here, including how people can be informed and able to exercise what is good for them in multifaceted ways, both, and I think the tobacco example really illustrated that if people are freed from certain ways of producing a product, and it could be, in this case it was tobacco, but it could be something else in farming, then it's good for their livelihoods, it's good for their families, and it is good for their health as well as good for the health of those who consume this product, which is their neighbors and whoever else, right up to the international level who is sold this product. There needs clearly, I mean, a lot of power rests in governments. These are people who set the policy frameworks, the legislation that govern everything, in theory, that govern what gets done in agriculture, that governs what gets done in marketing, in regulation, in the rules, in taxation, and in people having the possibility and the ability to purchase and have access to, in order to purchase food that is healthy. Because we know that in some contexts, depending on where you live, such food is just not available in your neighborhood, and you have to spend more in order to find healthy food, which in itself costs more. They have the power to tax these products so that they determine how the private sector invests or not, or is able to market these products for countries. So I think their authority and their power is extensive. The power of the private sector is massive because they are able to influence at all levels. And again, this Kenyan example was they were able to influence politicians. We've seen them, at least if I take the example of the tobacco industry, influence through investment, support for foundations of influential people, establish scientific institutions that provide scientific evidence that goes counter to all of this. So at the end of the day, I think the power really has to be with people who decide, I'm voting for you because you're doing this, that they need to be empowered and informed, and who address themselves as well as investors in some of these companies to persuade them to do what is good. I'll stop there, but I think the really power lies in different places, but very much among those who govern, regulate, legislate, including of the private sector that is invested in their countries. Thanks.
Thank you. So any comments to this? Sorry.
Sorry, the accountability without borders implies domestically as well then. But my question also is, yes, you can hope for the regulators and all of that, but how can you empower the poor farmer to stand up for his or her rights without having to stick their neck out and get it chopped off? Is there some innovation in in how you can sort of digitally vote with your feet and let it be known that accountability is not served? Or is it a legal redress? I've been quite encouraged. Anders, you mentioned 3 instruments: politics, business, and activism, but there is also law. Young people in the Netherlands and Germany have sued their governments for climate inactivism, and in the Netherlands, young people sued successfully Shell, a company. So who's going to sue a food company?
And also, I mean, we can learn a lot from tobacco, what happened, research, changes of legislation, taxation, etc., but also people's values in societies. No one is smoking here today, thank you very much. But we did 30 years ago, changes, and also how we've been interacting or not interacting with the tobacco industry. But food is much more difficult, and there are even bigger powers there, of course, as you said. But the question is, can we learn something from that? As you were saying, Stefan, I'm not sure that we could sue food industry in the same way, but to learn from how we combined in some way the instruments here in terms of legislation, research, resources, but also the dynamics of communities and peoples and values, because that was really what was also been driving why we are smoking less, at least in this country right now.
Sure.
Yeah, it's a good example.
But I mean, if I may, people are also consumers of the products of these companies. People can be mobilized to connect to this farmer and encourage him, as well as act in places where what they buy makes a difference ultimately to the bottom line of companies. People can be investors, yes or no, in such companies and influence. And people are voters ultimately. They can influence what happens with their governments as well. It's very difficult. I mean, I guess we need to talk about the poor farmer. He can be empowered with knowledge, with support, and with, in a way, connection to other people. The farmer too eventually has his own vote in his low-income country, actually. So I think that also needs to happen. He is a parliamentarian. He is somebody who can influence the decisions that are taken in our countries as well. And I think we need to make people aware of that power and use the power that they have, because it does have an influence. And we've seen it have an influence in some countries around other policy decisions by legislators.
I was thinking of extension services. Is that a function that is controlled by government or business or others in terms of farm extension and support in sort of choosing what crops to grow, choosing what inputs to use?
Yeah.
Who's in charge?
I mean, that's a very good question. And again, I'll use an industry that I know, because sometimes farmers are being supported by the industry. But I mean, the government plays a role as well in providing support, knowledge, information, extension-related support. It varies in different countries. So there, again, is the possibility for some influence and support to people. Yeah, I mean, if again I refer to the tobacco industry, there, of course, there was a complete ownership of from A to Z by the industry of the inputs to the farmers, loans to the farmers who were indebted over years, the land on which they were farming. I mean, we hopefully, if we use that as an example, then we can find how to make the difference in other agricultural areas to dent, if you like, this total authority and power that was an example there.
Thank you. So now invite questions from the audience. And again, it's hard to see from here, but I think, yes, someone there in the back. Nice.
Yeah, thank you for a very inspiring discussion. And I wanted to come back to something that some of you mentioned, but especially Dr. Matshidiso, you were talking about taxes also. And I wanted to ask if you could elaborate a bit. Do you mean taxing unhealthy products? Because I think there's also another element of tax which was brought up a couple of years ago at the World Economic Forum in Davos, that large companies, including food companies, should pay their fair share of tax, but the tax agreement decision was delayed, I think, recently again by a couple of years. So just wondering about your reflections and the role that could play in leveling the playing field, perhaps, between consumers in different countries and companies?
Okay, I was actually referring to taxation of the product, of the food product, at the point of sale, so as to, in a sense, price it out of the interests of people to be able to buy it. Of course, that means there need to be alternatives that are available that are healthier. So maybe it might go with subsidizing healthier food products where that's feasible. And that's been tried as far as alcohol is concerned and has triggered a very strong response by the alcohol industry. I mean, I think we need to think about, so if you're taxing so that it's unaffordable, a particular food item which has been cheap and of which people have been buying in large quantities, as we see happening in cities in Africa, for example, the unhealthiest foods, people need to have an alternative. And what could that be? But that is one way which we've seen has very strongly mobilized the alcohol industry, if I take it that way, because in some countries, if you take my own country, Botswana, the same wine that you buy in South Africa at a much cheaper price is quite costly in Botswana, and there was a very strong pushback by the alcohol industry, which meant that it actually was having an impact on their profits, etc. So this is something, that's what I was referring to. But if you're talking about taxation more broadly, perhaps that's something that could be explored as well.
Yeah, Stefan.
I think that, to my knowledge, there is a proposition on a 15% tax on companies to be applied across all countries. I'm not sure that Sweden is helping in getting it implemented, and many countries are struggling, but so as to avoid sort of the race to the bottom between countries and moving profits around. But I know Anders had his hand up. No?
Yeah, no answer to this. We have a new government, so I'm not sure where we are on that. But no, but just say, I mean, there are another perspective on taxes, which is in some way more basic and quite straightforward, but still it's important to say that, I mean, first, yes, I mean, we have clear evidence that having taxation on certain products actually have an impact. And we need to learn and we need to spread the knowledge about this and evaluate constantly to see that we get the right impact. But there's another dimension when it comes to the food industry, because we need a private food industry. We can't have governments to produce food. That wouldn't be a good idea. And we need also to allow and to accept that industry is making money, that they're making profit. But they should make profit on something that is good for animals, for people's and planet's health. And that's my message here, then should they also pay tax? And we have a big issue in the world today that there are many companies that are not paying tax. And there are many governments who do not have sort of what I would call the right level of taxation. In Sweden, we have a very high level, we all know that, but there are quite a few countries where there is also space actually to increase the amount of tax that the government is collecting. And why is that important? That is important then to invest in some of the public functions, education, potentially supporting farming, but of course then health and healthcare. So taxation is important, but it's also important that we have a vibrant private sector that are producing the right things, but that they're also paying tax.
Thank you. Another question, if there is one.
Hello, I'm Gloria. I work with Africa Gruppena on food and land rights. Thank you very much for your presentation from WHO. It was really good to listen to, and I was really inspired on the alternative livelihood initiatives that you talked about. I just want to respond because there was one question from the first presenter on the other side, talking about who is actually going to sue these food companies. And you gave example from different countries, what they're doing in other initiatives. I would like to raise that communities within sub-Saharan Africa are actually suing different companies when it comes to human rights violation. But the suing comes in different entity. One example is actually how, for example, the wine campaign in South Africa, and that was also in collaboration with communities from Sweden as well, saying no to wine that support human rights violation. So there is that initiative. There's also campaigns when it comes to like seed rights. A lot of companies have been lobbying to have a regulation that actually regulates seeds within sub-Saharan Africa. And these regulations are good, but in details, they tend to favor company and exclude indigenous communities' seeds. So that already has an impact in the nutrition. And then also, I wanted to highlight when it comes to AP funds in Sweden. There are AP funds that are invested in human rights violation in Mozambique. So one of the things that communities within Mozambique are doing is actually campaigning against that is causing a lot of stress. So there is a lot of initiatives when it comes to suing food companies, but there is not enough collaboration and solidarity in terms of funds, in terms of research, backing up these kind of movements that is very vivid in the Western. So we all today have to try to, in our different roles, to actually support these movements, whether it's with research, whether it's going on the table, whether it's questioning our funds, how are used, and this will have a huge impact. Thank you.
Okay. Thank you very much. Any reflections or comments on that?
You know, I've done something fun over the last 2 years. I've given seminars with the law students down the hill next to Stockholm's Nordström, where we were last night. And I challenged them to actually figure out what they can do to better the world as law students. And I must say, I think we have something to do. I saw the Vice Chancellor here, to inspire the law students here really to become legal activists and do what you're asking for. So I think there are some lessons to take home.
Yes, thank you. So, yeah, I will actually save my last question to you, Loay, but so I will invite the other ones for a short final words. So what do you see is the next important step for healthy food from a healthy planet? And Anders, you're invited to start.
A little bit building on the human rights, but another perspective on that. That has to do with the inequities in societies, different socioeconomic groups, different opportunities. I'm speaking from a health perspective. We see this explosion of what we call non-communicable diseases, cancer, cardiovascular diseases. Most people think that these are diseases for rich people. They are not. Those are affecting poor people most. Poor people and the lowest socioeconomic groups are most at risk when it comes to food and when it comes to other risk factors. And for us to have more deliberate strategies to both to visualize that this has to do with poverty and inequity, and also finding ways of closing the gaps. That I think is extremely important. And for me, in some way, that's a human rights question.
Thank you. So, Stefan, this is your final word.
Thank you.
Welcome.
I would like all of us to stop saying lifestyle and making choices, because for most people it's life condition, and the choices are made for us. And it's up to us to make those conditions conducive to healthy people and healthy planet.
That was a very concrete thing. I'm going to try to remember that, because I say that often. Thank you. Sidi, what would be your last reflection?
Yes, thank you. I very strongly agree with you. I think one of the things we saw from both tobacco and alcohol was talking about responsible drinking, making this very much an individual responsibility. So I think that's something that I very strongly support. Just inspired by the young lady there, I mean, I think that the kind of coalitions across different organizations and the sectors that we've talked about here really deserve to be supported and to be made to function and to be expanded. So that would be my takeaway. And in that said, in terms of who can influence, who can have in solidarity support some of the indigenous within Africa, you're saying actions by communities to push back on this. I would say that, we have young people. I have a lot of hope in young people, people like you who have strong opinions, who have bought into this agenda, who but young people really believe in dealing with climate change. We've seen them screaming at leaders in conferences and saying, you're really not doing enough. There are lots of young billionaires all over the world today who've had a startup and made money. I believe our cause could mobilize young people globally and get them connected to other people in other countries, including some of the work that you are doing, and provide some of the support that's needed, and perhaps inspire or shame some of us as well into playing more our role. So I really think there's a lot of hope in the actions, the views of young people, and we need to mobilize it and work with it.
Thank you. And last but not least, last word from you, Loay. So what are your expectations on your government, Loay is from Egypt, and the world as we gather in Sharm el-Sheikh for the COP27 in less than 2 weeks?
Well, it's now almost 2030, and we can say that we're significantly off track when it comes to achieving the Paris Agreement targets. We're clearly running out of time, and we can see that the world is still divided by wars, pandemics, crisis, inflation, and many other problems. We can see that we strongly need our governments to issue strong policies, and not only policies, we need these policies to be translated into actions and projects on the ground that actually has impact on the people and the impact on the climate. So we definitely need our governments to unite together and work together into solving this climate crisis. And when it comes to young people, we need mainly 3 things. We need from our governments access to proper education opportunities. We need them to invest in young people and empower them. And we need them to engage with young people and make them part of the decision table. And the responsibility of the climate crisis does not fall on governments as well. Young people have a role to play. Young people in the end are the ones who are going to inherit this planet. It's our generation and the future generations that are going to have to deal with all these problems. So to the young people, I tell them, we're the ones who are going to deal with this. So stand up, speak up, take action, because it's our problem in the end.
Thank you.
Thank you.
And that is our closing. So thank you very much for your insights and sharings. And yes.
Thank you.
Thank you. Thank you.
Thank you.
So, and I have only one task left, and that is to introduce Dr. Björn Eriksson, who is the director of the Medical Products Agency of Sweden. Welcome, Björn.
Thank you. The very last minute of this event, I have the mission to acknowledge all people who have worked a lot to arrange this summit. This has been a summit dedicated to sustainable food systems and with a special focus on health. We have been committed to help individuals, organizations, and countries in the shift towards more sustainable and resilient food systems. And this has been done by convening actors from different sectors, and the aim has been to break down silos and at this place discuss policy and evidence-based implementation. And if you ask me, I think this has been a success. It has been a fantastic 2 days and with the highest level of knowledge discussed, and it has also been, not at least, efficient networking between different individuals from different sectors and different countries. So, finally, I want to express my sincere thanks to, first of all fantastic speakers who made the journey here and took the time and effort to come and enrich our meeting. You have certainly provided us with both inspiring and interesting perspectives. So thank you to the speakers. And then I want to thank Louise Hård of Segerstad, our moderator, who guided the discussions with so much insight and clarity. So thank you, Louise. I also want to thank our truly multisectoral program committee, led by Professor Karin Artursson. And Karin, despite the complexity of the theme, you and the committee managed to develop a coherent program resting on a solid common ground. So, great thank you for this. And finally, a big thank you to our project secretariat. And this is Kerstin Stewart, Monica Gutestam, Ellen Genstrand, and Anna Ledin. Thank you a lot. And finally, we are looking forward to the next meeting, to the next Uppsala Health Summit. And we are now choosing between a lot of excellent ideas and subjects that we want to highlight. And I wish to welcome you to propose and discuss with us what we should do in the future, and a great welcome back to Uppsala. And thank you.